a real health hazard to people.
And you know, when I came down to Washington, D.C. last night, I didn't know what Nate was going to say, that the center of this would be moving down here.
With
you really couldn't
brought it
see
with
it.
you.
I brought it with me. You really couldn't see anything this morning. It's clearing a little bit this afternoon, but a lot of people on the streets are wearing masks. I'm encouraging them to wear the high-grade masks. The danger here is from something called PM 2.5, which, Martha, is the tiny particle that gets deep into your lungs, which is why the American Lung Association calls this an extreme risk, extreme hazard to the lungs. This is for people with pre-existing lung disease. This is for people with asthma. You know, I encourage people to take an extra inhaler. People should obviously stay indoors, but there's also a risk to the heart here, because if these particles stop the oxygen, you risk a heart attack or you risk a stroke, and we're at concerned about that risk. It's moving south from here. It's going to move west to the Ohio River Valley. Nobody's out of the woods yet. You know, this is reportedly the biggest amount of smoke we've seen from wildfires in almost 20 years. And again, the health issues, staying indoors, obviously, having a filtration system that's up to date, using recycled air in your car, changing your filters if you can, and really be on the lookout for young children and people with chronic conditions, especially lung conditions.
But let me ask you this. Obviously, a lot of people have to go outside. I mean, I walked to work today. There were people walking to work all around me. You know, what should you look for? What's a concern? Because if you feel a little bit like, you know, it feels like a little heavy or whatever, but what's a sign that you need to go to a hospital, you need to call your doctor?
So that's a great question. Obviously, with people with asthma or with breathing problems, I look for shortness of breath. And no, I don't think that person should have been jogging on the bridge in Philadelphia that we just saw without a mask. I encourage people that are at risk to wear masks. But to your direct question, there's also carbon monoxide in this smoke. And so we look for headache and fatigue. You're just not feeling quite right. The first symptom that people usually have is they feel it in their eyes.